You know, as you probably know, the Buddha talked about how mindfulness of death is the most powerful mindfulness practice there is, where this very breath, this very inhale could be our last. And it's not theoretical, it's factual. It's like this actual inhale could be my last, and which makes it very powerful. You know, like we come to terms with that possibility or that reality. So I'm just kind of curious how mindfulness of death in working with others may have impacted you in your own process of looking inward.
Well, I know the Buddha had this meditation that he had his monks perform, which is to imagine themselves as dead bodies and then imagine themselves as rotting dead bodies and then imagine themselves as skeletons and then imagining themselves as disarticulated bones and imagining themselves as bones going to dust, you know. I can't say that I've ever done that kind of mindfulness work. I could talk about my relationship to mindfulness, but as I said in one of my books, I have a profound relationship to meditation. I think about it every day, you know, which is about sums it up most of the time, despite the fact that I've also participated in some long-term meditation retreats and all that. I have not had a regular practice. In terms of my own death and palliative care, I tell you what I got from palliative care. One is, first of all, the acceptance of one's limitations. Now, in medicine, we're very much geared to curing people. And it was interesting when I was working in palliative care, how some physicians just would not visit their patients in palliative care because they couldn't face their own failure, that I didn't cure this person. I also suspect they couldn't face their own death. When you're working with dying people, as a physician, it's both humbling and, in a sense, liberating. Humbling in that you get it, that you're not God. You can't do everything. You can't make people live longer than they're going to live, except maybe by a few days. But it's also liberating because you give up the striving that I have to do something. Your job is just to be there with them. Presence is the biggest lesson that I derived from palliative care. You really have to be present with people, with whatever they're going through. You help them with their pain, but first you have to accept their pain. You help them die in the way that they want to, but first you have to accept their death. And you also see how people relate to death. One case I remember a woman, now typically, and this is another discussion, but a lot of people who die young of cancer are people who haven't really taken care of themselves emotionally all their lives. They've been kind of there to serve others, but not themselves. And they have trouble saying no to other people's expectations. And there was a woman in her 60s, early 60s, dying of cancer. And she had 2 adult daughters. And we were giving her intravenous supplementation. And I would sit at the bedside and talk to these people. And I asked her, look, we're giving you the IVs. As you know, the IVs are keeping you alive a few days longer. Do you want that? She says, no, I don't. I'm ready to die. I said, well, why are you still having the IVs? She said, because my daughters can't accept my death. And I said, look, you're my patient here, not your daughters. What do you want me to do? What would you prefer me to do? She said, I prefer you to take out the IV. And I had to meet with the daughters and tell them, look, I know you want your mother to live as long as she can, maybe a few more days, but that's not what she wants. She's asking me to put an end to it. They hated me. They couldn't stand it. Years later, they still hated me. But what I had learned is that my duty is to be with that patient, to present to what she wants, and to serve her. And if that meant that she would die 2 or 3 days earlier, that's what it meant. And so I too had to learn that I can't please everybody. So there's so much that I learned from these patients.
We provide you with the certification and the credentials you need to teach mindfulness in professional settings. I invite you to check out our webpage at teach.mindfulnessexercises.com to learn more about the program, and I look forward to seeing you on the inside.